Welcome to Healthy Vision Talk Radio, the podcast for people in search of a physician with alternative solutions for their eye problems. From the best-selling, award-winning, world's only homeopathic ophthalmologist, here's your host, Dr. Edward Kondrot.
Nessun Dorma from the opera Turandot. I will conquer, I will conquer. Welcome to Healthy Vision, the talk radio show that helps you conquer your vision loss. Dr. Edward Kondrot is a board-certified ophthalmologist and homeopathic doctor, author of 7 best-selling books. Healthy Vision is dedicated to bringing you the latest information for a lifetime of healthy sight and to help you conquer your eye problems. And now your host, America's favorite eye doctor, Dr. Edward Kondrot.
Welcome to Healthy Vision, and thank you so much for joining me this evening. And this evening we have a special treat. The show was supposed to be focused exclusively on glaucoma, but I'm going to keep that promise. We are going to be talking about glaucoma, but we have a special guest, Garrett Murren, who represents the Radiant Life Technologies company. And this company is the manufacturer of the Delta laser. And those of you that have visited my practice know that I'm a big advocate of light therapy, and we routinely use the Delta laser for treating various ocular conditions such as glaucoma, macular degeneration, corneal problems, inflammation. So, Garrett, thank you so much for joining us on Healthy Vision.
It's my pleasure, Dr. Kondrot. I got a few things today.
Yeah, I guess we've known each other now for the last 8 years, and you've been with the company for 10 years. So you have a lot of experience in not only helping people with eye problems, but, you know, the Delta laser is more than just for the eye. It's just a general device that can help so many issues. But we're going to mainly focus on the eye this evening. But for the folks that don't know you, Garrett Murren, and Radiant Life, maybe you could give us a little bit about your background and your company.
Sure. First of all, thank you for having me on today, Dr. Kondrot. And I had some very interesting material, I feel very related to glaucoma today, some studies from outside the U.S. But before we get to that, Radiant Life Technologies, we started out a couple of years before 2009, and then 2009 we finally produced the Delta device, and we've been doing that for a decade. And I mean, how I got into this, basically, to cut a very long story short, many, many moons ago, I heard Joseph Campbell say, "Follow your bliss," and that just hit me right between the two eyes, and it wasn't, as life would have it, too long after that. I met up with some friends, and we were all wanting to help people help themselves. And then through this, we created the Delta. And it's been this journey ever since, like you say, not only with eye conditions, but right across the board, because there's some fundamentals that are, let's say, at the foundation of all health, and when the health is gone, all disease. So if I can just jump right into it, what I wanted to share today is that, like I said, we got some studies coming from outside of North America, and it goes without saying, you know, that many people, and of course doctors like yourself and other therapists, are not satisfied with simply the standard of care. They're seeking ways to obtain better outcomes. And these studies are all along that line. And as a, not spoiler, but I'm going to save what I feel is the best one for last. Now, they're all different therapies and modalities. Some of them are being used alone and in combination, but all of them are being used to improve outcomes over and above the standard of care for eye conditions. Now, I'd also, Dr. Kondrot, if we have time and see how it goes, I'd like to more or less take a peek under the hood, so to speak, and we can discuss a little bit about what these therapies are doing within the eye, you know, within the body to go along with that, so some of the listeners can have an idea on why it can improve things when you look at these therapies. So we got, like I said, 6 different studies, and these are all from ophthalmology departments of university hospitals. And like I said, they're outside of North America. And the people performing the studies are actually medical doctors who specialize in ophthalmology like yourself, and these are their PhD doctoral dissertation submissions. And, of course, anything to do with PhDs are carried out in university hospitals. So we're going to list a few highlights from these. And just to share a highlight, and maybe you could comment on this, Dr. Kondrot, but we've got about 6 studies here. Well, we have 6 studies here, about 260 animalized studies for safety and of the different therapies, and over 1,000 humanized studies in the clinic. So maybe you could give some context to that to the listeners, Dr. Kondrot.
Well, I guess anytime you're looking at a new device, but I wouldn't consider the Delta laser a new device. It's been in existence now for 10 years, but I became interested in the Delta laser. I've been a long-time user of Syntonic light therapy, and Syntonic light therapy uses non-coherent light. It's not a laser light. It's a light that has been shown to help rejuvenate the eye, help stimulate cellular metabolism, reduce inflammation. As a matter of fact, eye doctors have been using Syntonic light for over 85 years, and there's a great organization. And I think you have been a speaker and a sponsor of the College of Syntonics. They have an annual meeting where a couple hundred eye doctors get together to learn more about alternative therapies, in particular light therapy. But I became interested in the Delta when there was a couple of studies that were published in different photomedical journals demonstrating that laser light using the red infrared spectrum definitely had a positive effect in patients with a glaucoma and macular degeneration. And at that time, they were using a rather expensive laser out of England, and the price tag was about $16,000. And I really wanted to find a moderately priced laser, a laser that could be affordable. You know, my philosophy is I like to empower patients. I like them to learn how to do the treatments themselves. And then when I discovered the Delta laser, I said, my goodness, this is perfect, because not only does the Delta laser deliver the red infrared light, it also delivers the Syntonic light, which is a non-coherent, it's a non-laser light, and it also delivers a magnetic field and ultrasound. So I'm sure you can talk about studies that have been done showing that the combination of these modalities improve the overall benefit. So it's not just a laser. It incorporates 4 different modalities. So I've been using the Delta laser now for probably 8 years, maybe a little bit longer, and it's been part of my Restore Vision program. And I think it, like you commented, it definitely improves outcomes. So folks that are making changes in their diet, getting IV therapies, changing their nutrition, doing microcurrent, the Delta laser can make a difference in terms of the outcomes. Absolutely.
And, you know, that's when I was drawing together these studies, of course, I was thinking about that in the sense of the drawback. The only drawback I see of these studies is, of course, people have to go to the clinic and to the doctor to get the treatment, you know, and this is on top of all the assessments and checkups. So when we talk about these today, of course, I'm going to refer back to coMra-Therapy, because what I want to draw people's attention to is they can do this for themselves. You know, yes, by all means, go visit your doctor, get the assessments, checkups, and the guidance, but there's a lot that people can do for themselves. You know, I get, you know, like your introduction to the show, there's always hope, there's always options. We just need to keep moving, and people can take a far more active role in their health. And when you're talking about the combined therapies, I just wanted to give a bit of history for people. I mean,
wait, hang on with that thought, because we're coming up to a break. And so when we come back, you'll talk a little bit more about the combined therapies. But before we come to break, I just want to make a comment. Those of you that are listening, it is important that you do maintain care with an eye care professional. These devices we're talking about are wonderful, but in many conditions such as glaucoma, you do need to have your eye pressure monitored. So I do advise you that if you are considering any of these therapies, please maintain close contact with your eye doctor. And if you're listening and you think you might be a candidate for the Delta laser, I would be happy to review your records and do a free consult with you. Simply go to freeconsult.us. That's all one word, freeconsult.us. Send in your eye records. We do require that you have recent eye records, and I'll take a look at them and I'll let you know if you're a candidate. So when we come back, Garrett's going to be talking more about the power of combining these treatments. We'll be right back after this break. And this is Dr. Edward Kondrot, and with me is Garrett Nuren, representative from Radiant Light, and we're talking about the Delta laser, an extremely valuable technique to help you restore lost vision, and also help you to restore your health. So, Garrett, you got me on the edge of my seat. I want to hear about these 6 studies.
Okay, so let's just jump right into it. This first one is really about the cornea, the front of the eye. And what they use is a thing called MIL therapy. And just like phototherapy was developed in the 19th century, and then that was the grandfather of low-level laser therapy, MIL therapy stands for magnetic infrared laser therapy. And this is back in the 70s. They started to combine the therapies. And then from there, the natural progression now is coherent multi-radiances or multiple therapies. And this here, really, what this is about, why I wanted to talk about this study, they got 50 rabbits, a couple of hundred people, and what they check, they look at, okay, does it improve the outcome of the cornea? Because people come in, they got blunt eye injuries, they got keratitis in their eyes, these ulcers, and what they find when they do the treatments, okay, no scarring. All the scars are gone compared to the standard of care. And I mean, the standard of care is not really enough when it comes to the front of the eye. And not only that, but all the fluid, moisture, that composition in the front of the eye is all improved from the treatment. So when you look at this, what it does is it means people have a lot better outcomes compared to the standard of care. They no longer have the drug dependencies, the allergies go down, the scarring is reduced. And this is not only from traumas, this is actually from surgeries as well. So when you look at this MIL therapy, this predecessor to coMra-Therapy, we get the same kind of outcomes. You had this one doctor sharing a story with me. She had a patient come in. They'd been to the university hospital. They said, look here, take these steroids. There's nothing else we can do. And she'd scratched the front of her eye by accident, and she's diabetic. So, of course, that impedes the healing. And her eye was a mess. And so the doctor did the treatment, and that cornea was all healed. So why I'm pointing this out is because, again, give you another example. This person came into the doctor. They had herpes in their eye years ago, all kinds of, surgeries and treatments to try and fix it. And they got a bit better, but they kept coming to the doctor and finally came to this doctor, and they treated with coMra-Therapy, and that keratitis was resolved. And also let's say the opacification of the cornea was resolved as well. So they had their vision improved, and of course the pain and irritation in the eye was improved. So this is one related study. Now the next one I want to get into, the reason for this is high power laser, and they use this to treat neovascular glaucoma. That's secondary one.
Oh, before you go into the neovascular glaucoma, I was thinking, one of the common operations that I perform is corneal transplants. I do a lot of mission work, and we do corneal transplants. We also do pterygium surgery, where we remove scar tissue from the cornea. And unfortunately, these folks have healing problems, and they need high doses of steroids. And I think that the Delta laser would be a perfect device to use to help reduce the use of steroids and also stimulate the healing. So essentially, this information you shared with me has just opened up a whole new a window of opportunity that I can see in helping these eyes heal without long-term use of steroids.
Absolutely. And one of the it's sad to do the animal studies, but we can benefit from them. coMra falls well into the safety margin compared to this predecessor, and they established, hey, this is beneficial to the eye. We turn the power up to here, and it's harmful. coMra is very safe. So not only, can you use it, but people can use it at home. And let's say you're going in for a surgery. Okay, I'm going to jump around a little bit here. This next one with the neovascular glaucoma, so what they do, they precondition the eye with low-level laser therapy before they burn the holes in it to relieve the pressure. Now, why they do this is because when they do, you know all about this stuff, Dr. Kondrot, so when they do that high-power laser, there's a lot of side effects and things like that, but they're trying to do it to preserve the eye and keep that person to have some vision. And when they do the low-level laser, the inflammation goes down, the healing is faster, the degree of, all the complications goes down, and then they get a much better normalization of that fluid flow, because it the vasoconstriction occurs like uniformly. So what this means is everything to do with the healing process is more effective. And this is just a monotherapy.
The neovascular glaucoma, that is probably the worst form of glaucoma a person can have. There's open-angle glaucoma, there's low-tension glaucoma. The neovascular glaucoma is you get these little blood vessels that grow inside the eye, and they cause inflammation. They block the eye flow of fluid. And it is, when somebody has the diagnosis of neovascular glaucoma, it's like blindness is knocking on the door. It's like blindness is right around the corner. And so I'm really excited about this because I see, I'm in consult with a lot of patients who have neovascular glaucoma. They're really looking for an alternative treatment. And I'm not saying, don't have the laser, don't have the surgery, but it is really exciting to hear that there can be an adjunctive treatment. And it makes sense to me using the delta laser to reduce the inflammation, stimulate healing, help lower the pressure, all these things. Like you said earlier, we're looking at things to improve the outcome. And I think this is just a beautiful combination.
Absolutely. And it also, just to piggyback on that, when you think of people going for x-rays, because it's not just the eyes, so you can treat before you go to an x-ray, and what it does is it mitigates the effect of that ionizing radiation. So you take a little old lady with osteoporosis, this is, a huge issue. They don't want to get too many x-rays, but they need them, so they can mitigate that. And, of course, the flu, you can keep your immune system healthy. Any kind of procedure people are going for. I was questioning this study, why didn't they do the low-level laser after? Because with coMra, we always say, look, do the procedures before, do the treatments before to precondition your body so it's stronger to go into the procedure, and then do it after, and the recovery is that much better. So, I just wanted to touch on that based on what you were saying. Are you ready for the next one, or you want to comment on that?
No, I'm ready for the next one.
Okay, great. So now this one here, pretty standard. They were just using straight up laser, low energy laser. Let me just qualify that. Not everybody knows. When I say low energy laser, low level laser, in case people aren't familiar, what I'm referring to is when it's applied to the body, it's not going to heat up or damage tissue. Where a high power laser, like we just looked at, is actually used to burn a hole through tissue or coagulate tissue, something like that. But this is a much different effect. And what it does, it increases the efficiency of the healing process. Body's healing 24/7. Dr. Kondrot, you know all about that with stem cells and all of these things. So we can support the body in that healing process. Because when you look at the standard cure, there's only 2 bullets in that gun, drugs and surgery. And many people want to know more that's out there, that's available. So this is one of the options. And when you look at this study, let's say they had 151 people. These were hospitalized. And they took the rabbits because, of course, first they want to use it on animals, and this is, they want to establish the safety. These are university hospitals, yada, yada, yada. And then once they say, okay, this is safe, they go to the hospital and they start using it, and then it becomes part of the hospital's protocols as a standard for patients coming in with glaucoma. And they use a bit of a different classification. They use advanced glaucoma and then chronic. And what they say, look, the problem is for them, you got to keep coming back for the treatments every 3 to 4 months in order to keep that pressure stabilized. Whereas, again, we come back to coMra-Therapy, you can, again, like you said earlier, be in contact with your doctor, get your checkups, do all the things, make sure they're in on what you're doing, but you can do so much at home. Yeah.
Oh, we got another break. Garrett, we have another break coming up, and I just want to mention that you are going to be a featured contributor to the Vision event that's coming up next year, February 15th and 16th, and you'll be giving an introductory talk on the Delta laser, and also you'll be supplying the folks with a workshop. So I'm hoping during the workshop you'll actually give a live demo, some demonstrations on different types of treatment. So we'll be right back after this break, and Garrett's going to finish up talking about his second study using the Delta laser in treatment of glaucoma.
The true voice of Arizona. Independent Talk 1100 KFNX.
Welcome back to Healthy Vision. This is your host, Dr. Edward Kondrot, and with me is Garrett Barron, talking about the Delta laser. But just to comment, there's an Australian company called Alex, and they just came out with a new laser that uses low levels of red, infrared, and it is used for treating macular degeneration, and it's a direct application to the retina. You put 12 spot sizes, and studies have shown that using this laser treatment, this focal laser treatment, which is not destructive, it reduces the progression of macular degeneration by 76%. Phenomenal results. So this is just a different application of the infrared laser, which is now being applied directly to the retina in a very low level and a small spot size. So we're probably not going to have time to go through all the studies, but folks, Garrett will be featured at the Vision event, February 15th and 16th, and this is going to be a live streaming event. It means you don't have to go to Florida. Everything will be online. So if you want information on that, go to KondrotEvent.com, KondrotEvent.com. So, Garrett, let's talk about this last study, which I am very, very interested in hearing the details.
Okay, Dr. Kondrot. Just before we go there, just to finish off on this with the laser and the glaucoma pressures, just to relate to from coMra, had this man come in. His left eye was at 30 millimeters of mercury and 22 in the right. And after 1 hour of treatment, they went down to 19 and 24. And then after 2 weeks of treatment, down to 18 and 19. And this is not uncommon. So there's lots of improvements that could be made. So there's a number of other studies we won't get to. I'm just going to talk them through very quickly with the titles for you. So we have healing glaucoma with laser acupuncture combined with supplements. Very interesting because they work in conjunction. They work synergistically, and the effect of coMra-Therapy, as an example, is going to increase absorption of any supplementation people are getting because we're increasing that efficiency. So just to relate that. And then another example, using ultrasound in the treatment of primary open-angle glaucoma. Again, this is not only reducing the pressure, but also opening up the visual field and just overall improvement over the standard of care. Now, this last one we'll get to, we'll talk about it for a few minutes. This one's I think you're going to find it very interesting, Dr. Kondrot, because what it is, they've taken laser and microcurrent, and we do this with coMra-Therapy and microcurrent to get even better outcomes. So they combined them. First they did it on rabbits. They wanted to find out, can we do this? Okay. The only thing I don't like about this study is they did an invasive procedure where they're directly on the eye and the person's got to get anesthetic, yada, yada. But what they found, because with the with the rabbits, of course, they do the studies after the rabbits are dead, and they checked, and they said, you know what we're actually doing here? I'm just going to basically quote from it. Assessing the effect of the microcurrent and laser on the optic nerve atrophy, because that's what they're treating, that optic nerve atrophy, because when we talk about the glaucoma, this is the big concern. We're reducing the pressure to take it off that optic nerve, or if it's low pressure, it's still the optic nerve is the whole issue. So it can be concluded that structural reorganization of the myelin sheath, now think about that myelin sheaths on the nerves is actually regenerated under the influence of the microcurrent and laser stimulation. And this is in combination with, all the electrophysiological parameters of the eye, the foveal sensitivity, the visual fields opening up, all of those things. But just think about this. We're told, the nerves are no good, nothing we can do. But if there's any life left in those nerves, what they found in this study, as long as there's some life left in those nerves, they can regenerate. Now, the completely dead ones are completely dead. So this opens up a huge field. And so with coMra-Therapy, to give you an equivalent, we've done the study, when we do the treatments with people, their visual fields open up. And as you know, Dr. Kondrot, those visual fields opening up is the indication that the pressure is off the nerve, that the nerve is actually getting better, because with the standard of care, they're just trying to slow it down. But with these types of treatments, we can actually improve it, not just slow it down.
Yeah, and that's so important because, the standard treatment for glaucoma is patients either have surgery or they're prescribed eye drops, mainly to prevent the progression of loss. You never talk to a conventional eye doctor saying, well, take these drops and it's going to restore your vision. And that's been an interest of mine. What can we do to stimulate regeneration? Because even if someone has lost vision, the question is the vision loss due to dysfunction of the optic nerve, or is it due to death of the optic nerve? And I think in most cases, especially when you catch the vision loss early, it's due to dysfunction. And by stimulating the optic nerve, and as you mentioned, the study showed that it does regenerate the myelin sheath, which is a critical, important part of the optic nerve, an important part of the function. If it shows that the myelin sheath is regenerated, that is very, very good news for those people who are looking for a method of helping to not only stop the progression, but actually to regenerate the eye. So that's very, very exciting. And, of course, I see this in my practice. I routinely combine the microcurrent with light therapy, Syntonic light therapy, and the cold laser, in particular the delta laser. So I see this clinically in my practice.
That's fantastic. And just to touch on the myelin sheath, because it's fantastic with the optic nerve, but it also works with other nerves too. You have people dealing with different neuropathies. It's not just the neuropathy of the optic nerve, and they get great results. And I'll just give you an example because, people don't understand what the process is necessarily. So you take an example of multiple sclerosis and that demyelination and the person losing function. So we have, when we get to the conference, I'm going to relate a long-term case. This lady's been using coMra-Therapy since 2010, and she's kept a diary and, worked with her doctor and all of these things. And you can see the progression, this regeneration. Remember you said the dysfunction. So each step, the body is always, let's say, it rebuilds to the ability it has, and then it creates new cells, and it rebuilds the ability those cells have, and it creates new cells. But this is a process that people enter into where it's not just a pill for an ill, boom. It's this healing process that the body goes through. So being able to do things at home is absolutely critical, or else you're just going to spend years or months or weeks or whatever, but your valuable time in the clinic Whereas if you can partner with a physician who's on the ball and you can do things at home and they can support you in the process, I mean, you're so far down the road compared to where most people are stuck at. It's amazing. And just to relate a fact, this lady started multiple strokes. She couldn't even do the dishes without being in a chair. She now runs a center for Asperger's syndrome people, and she's up in the morning, 6:30, on her feet 90% of the day, and finishes her day at 5:30, and she wants to open more of this stuff. So imagine to go from you can't even wash the dishes to that. I mean, it's amazing, and this can happen for people as long as they get in that
truly remarkable therapy. But you made a good point. I think with the diabetics, especially if you have diabetic neuropathy and other issues, circulatory problems, the cold laser is such a safe and effective method. We're coming up to another break, but we're going to be opening up the line. So if you're listening and you have a question for either myself or Garrett Murin, you can give us a call at 602-277-5369. That's 602-277-5369. Or toll free, 866-536-1100. That's 866-536-1100. And remember that Garrett is going to be part of the Vision event. He's not only going to give a introductory talk on the Delta laser, he is also going to be giving an hour to an hour and a half workshop where he'll actually demo the Delta laser on a patient, so you'll learn a lot more about the Delta laser. And if you're listening and you think you might be a candidate for the Delta laser, well, I'll be happy to take a look at your records to see if you qualify. And you just go to freeconsult.us, F-R-E-E consult.us, fire out your records, take a look at them, we'll let you know if you're a candidate. So we'll be right back after this break.
No fake news. Independent Talk, 1100 KFNX.
Okay, welcome back. And you're listening to Healthy Vision. This is Dr. Kondrot. With me is Garrett Murin. And Garrett, I wonder if you could explain a little bit in more detail about the mechanics of the Delta laser, because I mentioned earlier that it has 4 modalities. And why is it important to have those modalities? Is there an additional benefit? So maybe you could explain this aspect of the Delta laser.
Okay, thank you. We can certainly touch on it. Hopefully people will show up or attend a conference in February virtually, because there's a lot to it. But very simply, coMra-Therapy combines infrared laser, magnetic field, ultrasound, and sequence color therapy. The reason for this is because when you combine them all, the outcome is greater than the sum of the parts. Now, let me explain that a little more from a different angle. What coMra-Therapy does at the end of the day, it increases the efficiency of the fundamental repair processes in the body. That body can be a human body or it can be an animal body. This is a biophysical response to the therapy, and it does it at the level of energy, matter, and information. So when you think about it, we're increasing what we would call the coherence of energy transfer. In other words, it's much more efficient. This is in the device, and it transfers into the body through these biophysical cellular effects. When we think of matter, we take the magnetic field and the ultrasound as an example. People have sluggish metabolism. I'm not talking about on a cellular level. It increases the efficiency of the transfer of matter, and this is what's happening all the time in the body. And when you think of energy, we looked at the glaucoma. Those cells in the trabecular meshwork there, they're too tired. They don't have the energy to actually open to let the glaucoma pressure out, for example. So it increases the energy in the cells so they can do their job more efficiently. And, of course, when you think about the body, everything's happening. You're not just talking about one cell. You're talking about millions and billions and trillions of cells all in a concerted effort, all together at the right time in the right place. And this is information is critical. So when you look at the radiances, what they do, they transfer the energy, matter, and information on a biophysical level. I don't mean the actual information or energy, but they transfer let's say, the tools to the body's intelligence to increase that efficiency. Because, I mean, at the end of the day, nobody is qualified like the body to heal the body. Only the body's healing the body, no matter what we're doing. So how do we best support that process? And again, we can best support that process through non-invasive means. And coMra-Therapy is completely non-invasive, because another aspect of combining the radiances means you can turn the power levels way, way down. That means it opens up the door much wider for everyone in terms of safety. Whereas you take, let's say, laser therapy on its own. We started to talk about it. We couldn't really get into it, not enough time today. But one of the complications is they had to be careful because you can easily overtreat, and then it's doing more harm than it is good. And then the same thing with the mill therapy, this predecessor of coMra. They had to be careful. Where's the overtreatment? coMra-Therapy is, the power levels are so low because it's not so much each individual therapy on its own. It's the synergistic effect of all of them working on the same volume of tissue at the same time. It's like going to see 4 therapists who are all completely on the same page. You're going to have a better outcome in terms of, let's say it's body work, massage, and craniosacral and all that. You're going to have a better outcome than one therapist alone, or 4 therapists who aren't on the same page is not going to be very good. We've all had those kind of massages. So really at the end of the day, what coMra-Therapy does and what its specialty is increasing the efficiency of the fundamental repair process that happen in the body 24/7, 365 from conception to death. And that's in any part of the body, because all of those basic energy, matter, and information, every cell, every system, every organ, all need the highest functioning matter or energy, the best, let's say, building blocks, and the most clear, concise information, just like we do as people. There's not really much difference if we can use that analogy. So at the end of the day, coMra-Therapy is really, let's say, it's the evolution of all of these predecessors that we started to touch on today. And that coherence increases the coherence of the body. So that when the body is more coherent, well, think about it. We've all had the experience. When life just flows, everything seems effortless. Well, compared to experience we have as people when life really doesn't flow and everything seems to take a monumental effort. So the body is going through the same thing, and with coMra-Therapy, we can provide temporarily that coherence, and the body goes, hey, I know how to do this, and then it carries on with that coherence. It has increased energy. People feel better. Pain is reduced. Function is improved. Sleep is improved. People don't get as many colds. They don't get colds at all. This lady with MS I talked about earlier, that's one example. She went from being sick all the time and on a litany of medications to no sickness while her family was getting sick and almost no medication. I mean, that's a huge difference. And this is not uncommon for people. So
I just want to make a comment that, it's there's so much research that has been done and on the molecular level that they've actually identified in some studies that the photon stimulates part of this cellular mechanism called cytochrome A, and that triggers the electron transport chain, which is an energy chain. So, it's been so well defined in terms of how this light therapy can stimulate cellular metabolism. And of course, we know that light therapy or light is essential for the circadian rhythm, for hormonal balances, on and on and on. So, this is such a wonderful therapy. And as Garrett mentioned, we want to gently stimulate your natural healing abilities, the natural healing ability of your cell and your body. And this is, I think, so important for those of you that want to truly restore your health, restore lost vision. This is a very safe and effective method to help really get the healing process moving in the right direction.
Absolutely.
But it's more than just the light therapy. Those of you who have listened to this radio show that I'm a big advocate of good nutrition and hydration. So we can stimulate the cells, but you do need the basic building blocks so the body can regenerate. Good nutrition and eliminate toxins in the body. So the modalities, so let's talk a little bit about the frequency, because you can actually adjust, and I think this is really interesting. You can adjust the frequency. Oh, the engineer just told me we're coming up to a break, but basically what the frequency is the vibration or the flicker of the light. The higher the flicker of the light, the more superficial the treatment. So if you're using the delta laser for facial rejuvenation, you'll have a higher flicker rate or frequency. If you want to go deeper into the tissue, it's a lower flicker rate. So we vary this depending on what part of the eye we're treating. So we're coming to a close on Healthy Vision. Garrett, thank you so much for joining me. You just supplied us with such great information.
My pleasure. I mean, we could go on for a couple hours with the information I brought.
Yeah, and I hope
we'll get to it at the conference. Yeah.
Definitely tune in to the Vision event, February 15th and 16th. Garrett's going to be a big part of the event. And for more information on the event, go to kondrotevents.com, kondrotevents.com. So, Garrett, thank you so much.
It's my pleasure.
And those of you that are listening out there, this is your host, Dr. Edward Kondrot, wishing all of you good health and clear vision.
We hope you enjoyed today's broadcast. If you'd like to learn more about alternative eye treatments, access free reports, or subscribe to Dr. Kondrot's newsletter, visit us at healingtheeye.com. If you enjoyed today's show, please write a review. We love hearing from listeners. To hear more episodes about alternative eye treatments, click subscribe and download all of our previous shows. We wish you good health and clear vision.